Good morning, everyone. Bear with me while I put on my glasses. Distinguished and honorable guests, it is my tremendous pleasure to welcome you to today's event, The Path Toward Universal Health Coverage, the promotion of equitable global health and human security in the post-2015 development era. My name is Elizabeth Cousins. I'm from the United Nations Foundation, and I have the great privilege and pleasure of serving as the moderator for this event. As you have no doubt noticed from the distinguished panel seated in front of you, the importance of this event and this topic, universal health coverage, could not be greater. And it is highlighted by the impressive list of 8 co-hosts for today's event: the governments of Japan, France, Liberia, Senegal, and Thailand, the World Health Organization, the World Bank, and the Global Fund to fight AIDS, tuberculosis, and malaria. Leading off our event, we are privileged to have with us extremely distinguished representatives of our co-hosts: Prime Minister of Japan, Shinzo Abe, Prime Minister of Thailand, Prayut Chan-o-cha, Dr. Margaret Chan, Director General of the World Health Organization, Minister of Health from Senegal, Dr. Awa Coll-Seck, Dr. Babatunde Ojetimehin, Executive Director from UNFPA. And have we had a change in our French representative? I'm not sure. We have the Undersecretary for Global Affairs. I cannot see you very well. I apologize. Madame Descotte. Thank you. We welcome you here. And we will later be joined very shortly by the President of Liberia, Ellen Johnson Sirleaf. So please join me first in welcoming our distinguished co-host to today's event. Well, it is now my enormous pleasure to introduce our keynote speaker, Prime Minister Abe. Over the years, Japan has shown its intellectual leadership in global health, notably through its introduction of infectious diseases on the Okinawa G8 Summit's agenda in 2000, which paved the way toward the establishment of the Global Fund, and through Japan's focus on health system strengthening at the Tokyo G8 Summit. Japan has been promoting universal health coverage as a crucial element of the Agenda 2030 for Sustainable Development. And with Japan's taking the presidency of next year's G7 Summit, we welcome Prime Minister Abe's leadership and plans to make investments in health a priority issue. So delivering our keynote this morning, please join me in welcoming His Excellency Prime Minister Shinzo Abe.
Good morning, ladies and gentlemen. I would like to express my heartfelt gratitude to all of you for your presence in the Path to Universal Health Coverage, co-hosted by Japan and the Global Fund. Under the policy of proactive contribution to peace based on the principles of international cooperation, I attach great importance to contributing to the peace and prosperity of the world. I also would like to contribute standing on the principle of human security, which focuses on each and every person to the solution of global challenges, such as the health issue. Japan has the experience and knowledge, advanced medical technology, research and development capability, and health-related manpower, all of which are necessary and appropriate in making such contribution. Hitherto, Japan has played a major role in the health sector. For example, at G8 Okinawa Summit, the topic of infectious disease was taken up for the first time as an agenda item. That took place in the year 2000. The outcome of the debate resulted in the creation of the Global Fund. I'm sure everybody knows that this fund has made a tremendous contribution in fighting against AIDS, tuberculosis, and malaria. There is a plan to make Okinawa the venue of that summit of 2000, the base for international medicine. There was an agreement at 2008 Toyako Summit in Hokkaido to work for enhanced health system. And in 2016, Japan will be the host of G7 Ise-Shima Summit and G7 Health Ministers meeting in Kobe. As the chair of G7, Japan will continue to make positive contribution in the health sector. At TICAD 6, which is the first TICAD to be held on African continent, health is going to be an important topic. There are two major challenges faced by global health. The first is how to strengthen global health governance in order to fight against public health crisis upon the reflection from the enlarged epidemics of Ebola hemorrhagic fever. The second is how to achieve the universal health coverage that would enable every person to access basic health service at an affordable cost at any time needed. This theme is included in the 2030 Agenda for Sustainable Development. These two challenges are closely related with each other. We have incorporated various approaches in these challenges in our basic policy for peace and health, which is our basic policy recently formulated on global health in Japan. On the question of public health crisis, while delay in the initial response was referred as the problem, I think that another importance would be to examine how to enhance global health governance, such as the improved response capability of the international community. While expecting a good discussion at the high-level panel established under the Secretary-General Ban Ki-moon, I wish to have our nation contributing to the discussion so as to draw the picture of what good global health governance should look like. In particular, what we need is a clear policy when public health crises break out as to how the division of labor can be devised among local governments, international agencies, donor countries, and NGOs in order to deliver assistance with speed and certainty to the field where it is most needed. In normal times, too, we need to structure a system that is capable in responding to diverse health challenges. In addition to the conventional issues such as mother-child health, undernourishment, and the like, there are emerging challenges in the developing world even, such as lifestyle-related diseases and aging. In order to cope with such diverse health needs, what is required is to realize universal health coverage. Common key to the response to public health crisis and the realization of universal health coverage is to strengthen health system. Developing countries are not in the same situation, i.e., income levels, different health system, the prevalence of specific diseases, and so forth. Therefore, what we need is a resilient, sustainable, and inclusive health system structured in a tailor-made way. In order to do so, mobilizing massive amount of funds and manpower, including that of developing countries themselves, would be indispensable. To this end, I believe what we need to do is to bring in respective expertise, knowledge, and funds from international agencies such as WHO, Global Fund, and the World Bank, donor countries, and private sector organizations, and to build a framework in supporting developing countries which are trying to structure their own health system. May I conclude my presentation by sincerely hoping that today's event be a step forward in creating future alliance for the attainment of universal health coverage through enhanced health system, and wishing that Japan play a leadership role in the international discussion. I thank you for your kind attention.
We have an extremely distinguished panel this morning, and we have asked all of our speakers to speak for only 3 minutes each. So, and it's a very thankless task for a moderator when you have such stature on a panel to try to keep time. So I'll ask you to bear with me if I have to give a reminder. It is now my very great pleasure to introduce our next speaker, Prime Minister Prayut Chan-o-cha, the 29th Prime Minister of Thailand. Increased domestic spending on health will be essential for the sustainability of health programs, and Thailand is an excellent case in point. Thailand is an upper middle income country for whom public spending on health takes the lion's share of total health expenditure. And Thailand has opted to transition from Global Fund support ahead of schedule, showing real leadership in Asia. Thailand serves as an important example of shared responsibility and country ownership, and an example for the Global Fund to learn from as it evolves its partnership with the government of Thailand during this transition. Your Excellency, Prime Minister, over to you.
Thank you.
Distinguished delegates, ladies and gentlemen, Thailand attaches great importance to ensuring healthy lives, which is in line with goal number 3 of the SDGs, because healthy citizens are important drivers of national development. And I firmly believe that investing in health is in the national interest for the well-being of all and for the security of society. Health and human security have long been top priorities for the Thai government, and we have strived to establish a universal health coverage system to provide access for all to necessary, affordable, and quality health care services. We view access to health care to be one of the basic human rights and a social justice. Thailand successfully achieved universal health coverage in 2002, and every government since 1970 has shown an unwavering commitment to increasing investment in the basic health infrastructure at all levels, resulting in the expansion of health services, and health personnel ranging from doctors, dentists, pharmacists, and nurses have been dispatched to all regions throughout the country. Thais now have access to more comprehensive healthcare services and extended coverage. And the increased access has also reduced disparities between the urban and rural areas and resulted in the reduction of maternal and child mortality rates from 72 per 1,000 live births in 1970 to 11 per 1,000 in 2014. And in addition to improving the people's health and well-being, the universal health coverage system has also helped to reduce poverty. Over the past 12 years, the reduction of health costs has prevented more than 100,000 households from falling into poverty. It is the policy of the Thai government to improve the quality of health services and the well-being of the people by ensuring that the universal health coverage system is applied to all in a non-discriminatory manner, focusing more on prevention than on treating patients after they become ill. Our policies also support public-private cooperation in this respect. The government has also provided legal and social protection to migrant workers, and we recently introduced the one-stop service policy to facilitate the registration for illegal migrant workers and their dependents. In the period between June and October 2014, the Thai authorities successfully regularized over 1.6 million migrant workers, helping to prevent human rights abuses and trafficking and ensuring access to health care. Thailand believes in international partnership and cooperation. We have been cooperating with the other nine ASEAN members and China, Japan, and South Korea in creating an ASEAN Plus 3 universal health coverage network, with Thailand as the region's center of learning in the area of health management and universal health coverage. We are also cooperating with Japan on technical projects to help drive the universal health coverage system and support global health networks. Thailand stands ready to cooperate with all countries and international organizations to promote and achieve universal health coverage. Reaching this objective will help us realize the SDGs and create a happy, secure, prosperous, and sustainable future for all. Thank you.
Much. I'm now pleased to introduce Dr. Margaret Chan. Dr. Chan is the Director General of the World Health Organization, and in this room hardly needs an introduction. Her tenure at the helm of the World Health Organization has seen dramatic global improvements in health, in particular through partnerships, and her commitment to universal health coverage is well known. Today, we will hear brief remarks from Dr. Chan on where our ambitions have gotten us today and what we have the potential to achieve next. Please welcome Dr. Margaret Chan.
Thank you very much, and good morning to all of you. But first and foremost, Your Excellency Prime Minister Abe, and of course Prime Minister from Thailand, all protocol observed. WHO warmly welcomes this initiative, and I want to thank the leadership of all the countries bringing us together as a very important side event in this UN General Assembly. Universal health coverage emphasis on fairness and equity in health, leaving nobody behind, is exactly what this UN General Assembly has just adopted as one of the important principles of SDG. And of course, let us not to forget the importance of human security, which has been championed by Japan for many years. Talking about universal health coverage, we have two excellent examples from Japan and from Thailand who have shared with you their experiences. But I'm sure, no doubt, we will hear many more from other countries. The evidence of investment in health is paying heavy dividend. The evidence is ample. We don't need to reinvent the wheel. What is important is for us to use the evidence, the best practices, and make sure we implement them to make sure that universal health coverage will take people out of poverty and share prosperity. Now, universal health coverage based on two very important components. In the past, the dichotomy between primary health care and the public health capacities to detect and respond to outbreaks and emergencies has to stop. And we have heard from, Dr. Talbot from Liberia, your experience in managing Ebola. The lessons we must learn is to stop the dichotomy. We need capacities to prevent, detect, and respond to outbreaks and humanitarian crises. And we also need health systems that are resilient to provide maternal, newborn, and child health, especially family planning, as well as HIV, TB, malaria, and non-communicable diseases. These are all health challenges countries of the world must face. So universal health coverage is a very, good example to illustrate how goal number 3 can come together. Because universal health coverage is a unifying concept. It provides a platform for integrated delivery of health services, as I have just mentioned. In this regard, let me share with you, why was Japan such a successful country in terms of, having very good life and good longevity, as well as good economic progress in the last few decades. Japan, since 1961, has introduced very effective guarantee of universal service coverage for all its people. And that achievement was part of a deliberate effort to foster social cohesion and human security. In Japan, everybody is required by law to have health insurance, and fees are strictly regulated by the government. I'm using this example to show colleagues there are plenty of lessons to learn, good lessons to learn. We don't need to reinvent the wheel. However, I need to emphasize one point. Universal health coverage is not cheap, but it is affordable. And I still remember Thailand. You used to say, you don't have to be rich to implement universal health coverage, but you do need the political commitment. You do need to mobilize the communities, the women, the children, and all the people who are living in villages to understand the importance of leaving nobody behind and providing the health services they need and the social protection that nobody should fall into the traps of poverty because they cannot afford to see a doctor, because they cannot afford to send a wife to have a safe delivery, because they cannot afford to support their parents who need treatment for cancer or for heart disease. So these are important lessons we need to learn from the rich experiences of many countries. The goal of sustainable development, as we talk about for the next 15 years, is to help countries, to support countries to realize self-reliance. And Prime Minister Abe, you talk about we need more money. Yes, but we need also more governance. We need institutions that put money to good use and deliver results and deliver on the health of the people. Let's not forget, UN was set up because we're here to serve people, we the people. And this is a very loud message. I just want to finish on one last point. Every health system in every country wastes resources. Let me give you one example. You may go to hospital ABC and you have done your blood test, but should you want to seek a second opinion, you go to another hospital called XYZ. Instead of sharing the test results, the hospital XYZ asks you to repeat all the blood tests. To me, this is a great waste. The power of innovation, data, and technology allowed us to share those kind of information with the consent of the patient so that we do not need to get more blood. I mean, that's painful for the patient, but also is a waste of resources. That is just a small example to illustrate, going forward for the next 15 years, there's not enough money to go around. But the money that is already pledged by all the countries, including Japan, Germany, and many others, would be sufficient to support countries that do not yet have the means to do so. Countries that have the capability to do so, you need to be held accountable to your people. So to reinforce the point you make, governance is extremely important. Governments, agencies, including UN agencies and WHO, we would like to hold us to account. And this is what we need going forward. Answer to the people. Global citizenship. Global governance. Thank you.
Thank you very much, Dr. Chan. You are always a clarion call in conversations like this, and I thank you. Let me turn next to Minister Awa Kolsek. Minister Kolsek has served as Minister of Health of the Republic of Senegal since 2002. Prior to that, she was Executive Director of the Rollback Malaria Partnership from 2004 to 2011. And if I may bid a grateful farewell to Prime Minister Abe, thank you so much for your leadership. Prior to that, she was Executive Director of the Rollback Malaria Partnership from 2004 to 2011, and she served as Director of the UNAIDS Department of Country and Regional Support from 1996 to 2001. She was Senegal's Minister of Health and Prevention from 2001 to 2003. She is a professor of infectious diseases and expert in public health and tropical medicine, and clearly needs no further introduction. So please, Minister Kolsek, over to you.
Thank you.
Excellencies, ladies and gentlemen, I would like, on behalf of the President of the Republic of Senegal, His Excellency Macky Sall, thank the co-sponsors of this sharing initiative between the Global Fund, the WHO, France, and the other partners who have joined us here today. We congratulate you that fact that universal health coverage is a central topic in Goal 3 on healthcare in the post-2015 development agenda. As we all know, universal health coverage could reduce health risks and the risk to fall into poverty. This is essential for the future of our planet and that of the people living on it. We will talk about this topic quite seriously because in Senegal we are beginning on this topic and we are ready to learn from many other countries. And some of these countries are here today and we have already contacted them and we are working with them to be able to improve our care. The President of the Republic, during his electoral campaign, almost 4 years ago, aware of the difficulties facing the population and access to care, committed himself to lead Senegal towards universal health coverage for more equality in the country. What is the situation currently in Senegal? Right now there are two issues, that of infectious disease and that of infant and maternal mortality and also non-communicable diseases. And this is crucial in a healthcare system. Universal health coverage is a major focus of the emerging Senegal plan, which works for inclusive social and economic development. In 2013, there was a launching of coverage because at that time, almost 80% of workers were not covered by healthcare system because only private workers were covered by this system. The majority workers in the country are in the rural areas and are in informal economic situations and therefore are beyond healthcare coverage. Our goal is to reach 75% coverage of the population by 2017, and we focused our strategy on the following areas: reform of basic healthcare coverage through community-based healthcare organizations, reform of the mandatory social health insurance, strengthening existing free care programs, for example, those for cesarean sections for the elderly and so on, but also the implementation of a new policy of free care for children under the age of 5. Ladies and gentlemen, we know we have much to learn, and we truly want to hear all the experiences from all countries so as to be able to achieve the goals that we have placed before us, because after 2 years of experience, we have moved from 20 to 32% already, and at the end of the year, we hope to reach 45%. Therefore, it is crucial that we can move towards significant results, but also towards permanent results for the well-being of our population. I thank you for your kind attention.
Thank you. Well, it is now my pleasure to turn the floor to Madame Anne-Marie Descotes, Undersecretary for Global Affairs, Development and Partnerships at the Ministry of Foreign Affairs in France. She will be representing Ms. Annick Girardin, who is the Secretary for Development, and we're very glad to have you here. Please, over to you.
Merci beaucoup.
Thank you very much, Madam Chair, and I would like to apologize for the absence of Madame Girardin. I'm very honored to be representing her at this very high-level panel on a subject that is extremely important to France. It is difficult to talk about the situation without recalling the importance of the significance of the Ebola virus epidemic in Africa. This crisis has highlighted the importance of a robust and resilient healthcare and health coverage system. The strengthening of healthcare systems is a major challenge for public health and for the allocations of ODA, and particularly if we take into account the future in several countries around the world and the challenges that will need to be addressed. A greater cooperation between affected countries and their healthcare partners is crucial, and the implementation of universal health coverages involves solidarity in terms of financing and what is perhaps the most important factor, which is healthcare human resources who are available and who are skilled. And I think that it is healthcare workers to whom we must pay tribute, particularly in the context of the Ebola virus disease. The healthcare workers themselves are a source of economic growth. They need to be properly paid, and they need to be well informed. This will contribute to a robust healthcare system. In 2006, we will be co-chairing the United Nations Commission to be created on sustainable growth. And in that regard, the the healthcare workers' situation will be taken into account. We need to give the population back the trust in the healthcare system, and we need to be able to provide healthcare for all and avoid a situation in which families will fall back into poverty. Universal health coverage also involves efforts to ensure that the 2030 goals address the issues of inequalities, social, gender, and geographical inequality, particularly between rural and urban areas. There are emerging health threats that we are now facing. We are all aware of these, and some of these are related to climate change. We can think about, for example, some of the way in which some diseases have expanded to been transmitted to other areas or countries in the world very quickly, and these transmission rates are another challenge that must be addressed. And states bear the primary responsibility for addressing these challenges. This will involve mobilizing domestic resources, and each state must define its own model for financing. Of course, solidarity is something that is key, and we will contribute to the strengthening and financing of this system. It is an essential component of any national development strategy. As I said earlier, the Ebola crisis showed us very clearly the extent to which national healthcare systems need to be more robust. There are a number of a number of institutions. We have Gavi, which is playing a key role in helping to boost the effectiveness of healthcare systems and around the world. And we are also working to ensure greater access for populations to healthcare. We also need to continue our support for healthcare systems. We need to ensure a sustainable funding for these systems. And in this way, the systems themselves will be more resilient and sustainable over the long term. And this is something that France is doing together with its German partners. We are working on a facility for funding healthcare together with WHO. The French Development Agency is also working with Expertise France on a number of bilateral matters in this context. Now, this is an investment. It is about an investment. It is not to be viewed as a cost, and it is a priority investment that must be made. I thank you.
Thank you. Well, it is now a real pleasure to introduce Dr. Babatunde Oshutimehin, who leads the UN Population Fund, UNFPA. At UNFPA's helm since 2011, Dr. Babatunde is a physician, public health expert, a former Minister of Health in Nigeria, and former Director General of Nigeria's National Agency for the Control of HIV and AIDS. Through his wealth of experience, Dr. Babatunde knows deeply the challenges and opportunities for achieving universal health coverage at all levels. He is also a passionate advocate for the opportunity he sees in young people and always reminds us that there can be no sustainable development without empowering, educating, and ensuring the health and economic well-being of young men and women, in short, allowing them to thrive. Please welcome Dr. Oshutimehin.
Thank you, Elizabeth. I think you've given my speech. Prime Minister Chan O-cha of Thailand, my sister Margaret Chan, she's not here now, ladies and gentlemen, let me start by thanking the government of Japan, France, Senegal, Liberia, Thailand, and our partners, WHO, the World Bank, and the Global Fund partnerships with member states for hosting this event and actually bringing universal health coverage to the fore. I think it was a great achievement that we were able to get that in the Sustainable Development Goals. I think it is important to underline the rapidly changing world into which the SDGs have been born and will grow, particularly in the context of the Goal 3 and its targets, one of which relates to sexual and reproductive health and the universal health coverage. I also think that it's important to note that the SDGs have been constructed to speak to themselves. So we must never really think of one without the others. So whilst we think of universal health coverage, we must also think about all the other things that actually would make a difference to universal health coverage. Education, the rights of people. And I think I just want to bring that up. A world with a population of 7.3 billion, projected to reach 8.5 billion by 2030, with more young people than ever before, and more aged people than ever before, increasing mobility, unprecedented urbanization, inequality which exacerbates high levels of extreme poverty, and increasing impacts of climate change. That's the world we're going to deal with, and that's the world that we have to provide universal coverage for. We're also seeing epidemiological changes in an unprecedented way, including the rise in non-communicable diseases worldwide. Weak health systems, which we've talked to, with insufficient infrastructure, human resources, and commodities hinder availability, accessibility, acceptability, and quality of healthcare services, particularly for those who are poor, vulnerable, or marginalized, or because of their age. For example, young people prevented from accessing services, which happens across most parts of the world. We have seen the emergence and impact of diseases that have mentioned Ebola, with devastating consequences to the health, well-being, economy of individuals, households, communities, and countries. And I want to put this context in this conversation, that we're faced with the challenges of ensuring provision of services in humanitarian context. We're going to get more humanitarian disasters as we go along, because climate change is a reality. And they would expand in number, in scope, and complexity. What do we see as our role in UNFPA? We are at the forefront in translating the vision and the goals of Agenda 2030 into tangible deliverables that can make a real and sizable difference in people's lives, particularly women and girls and young people. We will very much focus on supporting countries to address the how-to, generally in support of the SDGs, and specifically SDGs 3, which we're talking about, but also 5. We'll continue to champion sexual and reproductive health and reproductive rights as fundamental to sustainable development, while ensuring the unfinished MDG 5 agenda, which we have to realize. And I want to be a little particular. Strengthened health systems must include enhancing human resources for health. And we've done this in many places, Afghanistan, Ethiopia, and utilizing innovations, including mobile technologies, to improve the skills and capacities of frontline health workers, workers in remote areas, and enabling timely referrals and vital data registration. Supply chain management systems also have to be improved, and supporting improved service delivery and facilitating innovative financing. We have to provide healthcare for everybody, and it has to be affordable. And building synergies between provision of various services. In the circumstance we're talking about, SRH services, for an example, and other services in the health system. And as we continue to talk about leaving no one behind, we'll continue to focus as UNFPA on adolescents and youth, particularly adults and girls. As I speak, there are 59 million 10-year-old adolescents in the world. 59 million. Think about it. And that's just 10-year-olds. Now, we can then take it from 10 to 19 and imagine how many of them are in the world. 1.8 billion young people in the world today. And they can make all the difference. They are the change agents we have to work with. And ensuring that they have access to health, particularly sexual and reproductive health service, and comprehensive sexuality education is key to their health and well-being and critical to the success of the post-2050 development agenda. And we will continue to mobilize in response to the rights and needs of mobile and displaced populations and prioritize humanitarian response and recovery. We are committed to ensuring access to life-saving commodities and services and enable safe life everywhere and dignity and well-being of women and girls, even under the harshest circumstances. We at UNFPA have delivered 4,000 babies in the Zaatari camp in Syria without losing a mother or a baby. And I think we have to, all of us, get to the point that this is a reality of what we are going to have to be dealing with. And partnerships is vital and will continue. And I've just come from the GFF meeting and the H4 Plus and the FP 2020, the campaign for accelerated reduction of maternal mortality in Africa. There are going to be partnerships, and those partnerships do matter. Yes. So to make UHC a reality, I think that we just have to make sure that all of us work together. Prevention, promotion services, women and young people being central to our consideration. Thank you for listening.
Well, it now gives me great pleasure to conclude this distinguished panel to welcome Her Excellency President Ellen Johnson Sirleaf, the 24th President of Liberia and Africa's first democratically elected female head of state. President Sirleaf is a Nobel Peace Prize laureate who throughout her career has demonstrated courageous leadership and been a forceful advocate for the rights of women and the rights of all of her people, and the need for education, health, and other critical services to provide a better future for her country and its population. President Johnson Sirleaf is chairperson of the African Leaders Malaria Alliance, Goodwill Ambassador for Water, Sanitation, and Hygiene in Africa. She has led efforts on women in peace building. She has received numerous honors and honorary degrees. She has been routinely listed as one of the top 10 leaders in the world and among the top 10 female leaders. The Economist called her the best president her country has ever had. And she has obviously just led her country most recently through the Ebola crisis and can now count Liberia as Ebola-free. Please join me in giving a warm welcome to Her Excellency President Sirleaf.
Thank you. Let me say how pleased I am to join the co-sponsors of this event, the various countries, and particularly want to commend Prime Minister Abiy for being the one that spearheaded and promoted the coming together of this group. I was a participant a month or so ago in Japan's World Women's Assembly, and I know from the exchanges during that event the very strong commitment that Japan has made to the empowerment of women, not only in terms of talking about it, but the strong measures they've taken, both legal and financial, to ensure that women have stronger participation and a better life. Liberia shares the view that progress and prosperity of humankind is indeed measured in terms of their health as a basic human right and as human security. This is well enshrined in goal number 3 of the Sustainable Development Goal, our universal global agenda that we have just recently endorsed. We also share the view that to be able to achieve these goals, to be able to reach the aspirations that are included in this goal, that one has to have universal health coverage, including access to essential health care services and access to affordable essential medicine. However, Liberia, while having strong commitment and strong belief and duty to continue to strive toward the achievement of this goal in a post-conflict recovery environment, we are constrained to demand responses to multiple needs. We thus have adopted a comprehensive approach which links the healthcare effort to measures that address poverty, quality, education, gender equality, economic growth, and reduce inequality. All of these nowhere inconsistent with the general goal of ensuring that we get universal coverage. Prior to the outbreak of the Ebola virus disease, we developed and launched a National Health Plan covering the period 2011 to 2012 with the following goals: increasing access to and utilization of a comprehensive package of quality health and social welfare services delivered close to the community, those communities endowed with resources to enable them to have effective response systems. Making health and social welfare services more responsive to people's needs determined by themselves, responding to their demands and expectations by transferring the management and decision-making to the lower level, to as far as the community themselves, ensuring that health care and social protection are available to all people, or as many of the people, regardless of their position in society, and at a cost affordable by them and the resources of the country. While those were there, and these are really consistent with the call for universal health coverage and fitted well within our own economic stabilization and recovery plan, we stress strategic interventions for strengthening resilience and reducing vulnerability. Our recent experience with the Ebola disease proved to be a real wake-up call because it exposed the weaknesses of our health system, and it pointed out to us that in that call, we need a more vigorous fight against health-related challenges, particularly infectious diseases such as malaria, cholera, typhoid, all of which are at high levels of incidences in our country. We are therefore now embarking upon a multi-year revised and expanded planning process, which will include pandemic preparedness. This will require a lot of our effort. This will require a lot of knowledge, experience, drawn not only from our own recent experience, but also from cases before us, which for all of us is a learning experience. And we believe that our call to this as a global threat compels us all to look at this, to look at the health systems in many of our countries, particularly in the developing countries, to ensure that they have the response capability to be able to move against this threat that has worldwide potential. We would like to commend the strategic partners to us our bilateral partners that have been working with us to prepare this plan. Also, the World Health Organization and our partner, the Global Fund and Gavi, which have been really instrumental in designing proper partnership financing instruments such as the Pool Fund, which have enabled us to make great progress in our plans and in the responses that we have. We believe that this meeting and the experiences that will be tabled here will also enable us to continue on this path of preparedness and enable us to find new means, new measurements, new ways whereby we can all work together and determine the role that can be played by each of us, each of our countries, in a united way in hastening the right systems and response to global threats. I'd like to say thank you to all of those who have been here, and to say once again to the co-sponsors and to Japan that we are most grateful that they have organized this event to bring due attention to the cause of universal health care and its importance for overall development. Thank you.
Well, ladies and gentlemen, please join me again in thanking each of our distinguished co-hosts and panelists appearing today for offering their insights into universal health coverage and the actions we need truly to achieve it by 2030. We would like now to invite our distinguished panelists to exit the stage, and we will invite our next panel up for our second session of the day. Thank you again. And we still have Deputy Minister, we still have Dr. Tolbert as one of the panelists. Right. Okay, great.
Thank you, Southern.
I don't know if we need someone from your team to kind of orchestrate them up here. Oh, she's okay. So we're going to be, can we run over or are we hard stop? Oh, okay. But we'll, I think we just do one of it. We don't go to the second round. And then are we still seeing national content?
We haven't seen that.
So I'll say if we have, okay.
I would say no.
Okay. All right.
And if they want to get angry, they can get angry.
Fair enough.
Yeah.
I didn't realize that.
Yeah. How are you? It's good to see you. Good to see you. No, I didn't.
Yeah, sorry. You don't need me. Anything I can do?
Good.
All right. Or not to?
No, you're doing great.
Okay. We're still waiting for Dr. Tolbert. Can you grab him so we can... Do you want me to start or wait till... Okay. Thank you, everyone. I think we're getting close to being able to start our second session. So what I think, in the interest of time, I'll start introducing them while they're taking their seats. Today we are joined by 8 extremely distinguished panelists representing all the partners critical to the achievement of universal health coverage: government, multilateral and technical agencies, the private sector, and civil society. And each has kindly agreed to come here today to engage in a discussion that takes stock of where we are with the adoption of Agenda 2030 and the Sustainable Development Goals last Friday, and what needs to happen now to chart a critical path to achieving the SDGs and in particular Goal 3. I thank them for agreeing to participate, and we have a very rich exchange to look forward to. What I will do now is introduce all of them, so you have to bear with me. It's a large panel, so I will introduce all of them in turn, and then the format will be that I will ask a question to each of our panelists in turn, and then I think given timing, we will probably then go to our concluding comments from Mark Dybel. So very, very exciting. Let me just briefly introduce them in turn. First, we'll have His Excellency Dr. Tolbert Nyenswah, the Deputy Minister of Health of Liberia. Deputy Minister Tolbert assumed his post in 2012, leading the planning and organization of all national disease control programs in Liberia. In 2014, Dr. Tolbert led the public health response in Liberia, and by mid-August 2014 was put in charge of the incident management system in the country. He launched domestic and international communications programs, coordinated many actors into coherent strategies, and engaged the community. And let me again congratulate you and the people of Liberia for being declared Ebola-free most recently. We then have Dr. Akihiko Tanaka, President of the Japan International Cooperation Agency, JICA, which is one of the largest bilateral development organizations in the world. Previously, Dr. Tanaka was Vice President of the University of Tokyo, where he was an expert in international relations and foreign policy. With the vision of inclusive and dynamic development, one of JICA's key missions is to help protect people from threats and vulnerabilities and to build societies where they can live with dignity, thereby achieving human security. And JICA, as you know, supports countries through technical cooperation, ODA loans, and grant aids, and has just signed the first ODA loan to support UHC in Kenya, I believe, in August 2015. Ingrid Gabriela Hoven is Director General of the German Federal Ministry for Economic Cooperation and Development. She is responsible for planning and programming German development cooperation, including with civil society and the private sector, with partner countries and multilateral organizations, with particular focus on global issues, including health and population policy. She is a board member of the Global Fund and was previously an executive director for Germany at the World Bank Group. Keith Hansen is Vice President for Human Development at the World Bank Group, and in this role, Keith oversees the global practices for education, health, nutrition, and population, as well as social protection and labor. Prior to this appointment, Mr. Hansen was one of the co-vice presidents for all the global practices, responsible for helping shape the World Bank Group's new operating model, which aims to bring together the best expertise from across the institution and from partners to help tackle countries' most complex development challenges. We then have Fatoumata Ndiaye, Deputy Executive Director of UNICEF. Fatoumata joined UNICEF in January 2013, bringing with her over 25 years of experience in private and public organizations. UNICEF's work in realizing the rights of children has had an increased focus recently on health system strengthening, with particular attention to equity of coverage of essential services for mothers and children, and greater emphasis on emergencies, including during the recent Ebola outbreak in West Africa. UNICEF has also deepened its collaboration with the Global Fund through the signing of a memorandum of understanding, particularly focusing on service delivery at the community level. We then have Magdi Martinez-Suleiman, Assistant Administrator of the UN Development Program and Director of the Bureau for Policy and Program Support. He is a lawyer by training, but we won't blame him for that. And he has been State Secretary for Youth in Spain, CEO of 2 public corporations, and member of the organizing committee of the Olympic Games in Barcelona in 1992. Mr. Martinez-Suleiman has been working for the UN for 15 years, where he has extensive experience in institution building in particular. And just a further word about UNDP. UNDP's contribution to universal health coverage and SDG 3 is now focusing on supporting countries to reduce the inequalities and exclusion that lead to poor health outcomes, to improve effective and inclusive governance for health, and to build resilient systems for health, including in crisis settings. And they are a committed partner of the Global Fund, the Joint UN Program on HIV/AIDS, and WHO, and is also committed to ending the epidemics of AIDS, TB, and malaria. And I think I have just two more to introduce. Again, it's going to be a very rich discussion. Deb Dugan is the Chief Executive Officer of RED. Prior to being at RED, Deb was president of Disney Publishing Worldwide. She also served as senior advisor to the Tribeca Enterprises boards. Her roots are in the music industry, and she spent many years as executive vice president at EMI Capitol Records and began her career as an attorney on Wall Street. With Deborah at the helm, RED has continued to push the boundaries for how social media can be used for social good. In 2011, RED was recognized as the first cause to have reached over 1 million on both Facebook and Twitter. And RED recently set a new record with the largest nonprofit check-in campaign on Foursquare to date in partnership with Starbucks, raising $250,000 in just 8 days. And last but not least, Maureen Morenga from Kenya is a member of the Global Fund Advocates Network. The Global Fund Advocates Network unites civil society voices and efforts from all over the world to support a fully funded global fund, building on the structures, expertise, and experience that have been developed since 2002. GFAN members are advocates, activists, and affected communities in all regions of the world. And as a speaker for the Global Fund Advocates Network, Maureen provides a personal perspective of the positive impact of the Global Fund on the ground, where it delivers its promise to improve and save lives. So please join me in welcoming our distinguished panelists. So let's immediately get into the conversation. I'd like to start with a question for Deputy Minister Tolbert. Dr. Tolbert, Liberia is on a path to adopt universal health coverage, and the national average ratio of facilities to served populations is lower than the norm established by the basic package of health services set in 2008. Can you describe how the basic package of health services and health systems influenced human security in light of the recent Ebola outbreak in your country? Thank you.
Thank you very much. And thank to the fellow panelists for being here this morning. You just listened to Her Excellency, the President of Liberia, giving an overview of what we subscribe. That Liberia subscribed to UHC, the Universal Health Coverage, and making every effort to see how we can achieve this. To put it in historical context, the question that have just been asked, Liberia was recovering from 14 years of devastating civil war, as you may be aware, that destroy every facet of our society, including health facilities, schools, the economy, and the already very poor people were dragged and abject poverty because of this brutal civil war in our country. But in less than 10 years, the President of Liberia, you saw Her Excellency, very energetic, made enormous efforts and put Liberia on the right trajectory to meeting high Code 5 value in democracy, building a healthcare system, looking at areas like human resource development for health, essential services, drugs, commodities. Enrollment of students have increased, access to healthcare increased, but we making every effort to get access in terms of healthcare facilities and infrastructure to where access is not available. From the past 9 years, the efforts that have been made will increase access to healthcare to 70%. The rest of the 30%, very rural areas, we're making significant efforts to train community health volunteers that can deliver life savings commodities like malaria drugs, TB, HIV, and AIDS, and also improve the maternal mortality, high maternal mortality ratio. In this context, all of the effort have been made. In 10 years, we added 20 years to the life expectancy of Liberian. Female 44, male 46 is increased now to at least 60 because of the progress that have been made thus far with these interventions. Malaria prevalence decreased from 66% in 2005 to 28% in 2011. Myself used to be the Deputy Director of the National Malaria Control Program, work with the Global Fund very, very closely to mobilize resources for Liberia, work with the President's Malaria Initiative of the U.S. government to get resources there. So all of this progress were being made before the 2004 Ebola crisis, 2014-2015 Ebola crisis, where the response to the Ebola crisis was very, very slow from the beginning. Liberia announced having a case of Ebola in 2014 March, and then we made every effort to intervene in terms of setting up the incident management system, setting up Ebola treatment units. Because of the weak healthcare system, we didn't have the infrastructure to isolate Ebola cases, as there were exponential increase in the number of cases, in the number of deaths. We had to build at least 19 functional ETUs, build community engagement, lab systems, put in place the dead body management team that were moving a lot of Liberians that were picking up in the street because of the crisis. And so today we have what we call the Resilient Investment Plan that's being developed to support our healthcare system, looking at key areas like HR re-engineering, our health infrastructure, surveillance and epidemiology preparedness, respond to any threat, detecting threats and responding to them. But in the context of this, Liberia has no fees for service in our facilities, but to improve on that, we subscribe to the 4 elements and 4 action of financing universal health care, that is reducing direct payment out of pocket, maximizing mandatory prepayment, establish large risk pooled. The President just mentioned the pooled fund of Liberia, where we bring all of the resources together to support our health services. And then general government revenue is key. But UHC, as it is in its context, requires significant development assistance in the short term. So Liberia will rely on all of our multilateral, bilateral partners to see how we can support it. In these efforts, the international community, the people of Liberia, we have beaten Ebola twice, and we are Ebola free. Thank you.
Thank you so much. In the interest of time, I'm going to ask each of our speakers if you can try to keep your remarks to just 2 to 3 minutes, and if I can ask our audience to maybe refrain from applause until the very end, just in the interest of time. I'd like to turn next to Dr. Akihiko Tanaka. Can you tell us a bit about Japan's vision on UHC, especially in responding to the health needs of vulnerable populations, including the most impoverished? Please, over to you, sir.
Well, thank you, Elizabeth. Our vision of UHC, of course, is this is an essential means to realize human security, which we consider very, very important in all parts of the world, including the countries with vulnerabilities and poverty. But I would like to talk a bit about somewhat more concrete requirements to go ahead with universal health coverage. I have 3 points. One, that we should not leave behind mothers and children in our efforts to achieve UHC. And second, infectious disease control, including pandemic preparedness and response, should be an integral part of UHC. And thirdly, we would like to argue that coordination is key, particularly among many partners for producing synergy between UHC, maternal and child health, and infectious disease controls. As we all know that we have observed significant improvements in the health of people in low and middle income countries, this is an achievement of global community united under the MDGs. However, despite their progress, the majority of African countries will not be able to achieve the goals on maternal and child mortality. Efforts to ensure quality health care throughout the course of pregnancy, childbirth, childbearing requires strengthening health systems at all levels, including at the community level. This, I think, can be an initial step toward the longer-term goal of universal health coverage. And second, as many people mentioned, the Ebola pandemic reminds us how vulnerable and unprepared the global community is against cross-border pandemics. Early detection and response, risk communication, and other essential public health functions needs to be strengthened in line with international health regulations. We should not forget that these essential public health functions are a critical part of proper infectious disease control and an integral part of universal health coverage. Significant increases in targeted funding from the Global Fund, Gavi, and other donors have contributed to the expansion of frontline health workers. The challenge now is to better link the achievements of targeted interventions with broader health goals. And thirdly, efforts to achieve UHC, the promotion of maternal child health and infectious disease control can be mutually reinforcing to the extent that coordination among stakeholders better made. I believe that coordination among those who are present here are essential to realize universal health coverage.
I ask you to refer. We all want to applaud, but just to keep ourselves on time. Germany. Germany has spearheaded investments in health systems, including its support to the Global Fund and through its G7 presidency. You've stressed the need for enhanced action to ensure progress toward UHC, and with WHO, just launched the development of a roadmap to define concrete steps toward a coordinated and effective international support to health systems strengthening. Can you tell us more about the goal of this future framework?
Thank you so much for your introduction, and many thanks to the organizers of this very important meeting. We, as the institutional actors and developing partners in the health community over the last year, we have created many fora. We have created initiatives in which we have discussed aligning our approaches and improving our performance towards strengthening health systems. Some with a broader and some initiatives with a more narrow scope. These discussions certainly have helped to create a higher degree of common understanding of what health system strengthening should mean in practice, and what kind of new ideas we should bring to this endeavor. But, quite frankly, unfortunately, this has not always led to changes in the way we, the international actors active in the health sector, work on the ground, or for the way we support partner countries in delivering health outcomes. Too often, still, the way we operate in countries is more a reflection of our disease or intervention-specific mandates, using coordination and reporting mechanisms that are often solely focused on our own institutional needs. Way too often, the requirements of partner countries, such as Liberia and others, their duty and desire to provide health services to their citizens remains an afterthought. I think we can be proud of what we have achieved over the last 15 years when it comes to very disease-specific health outcomes. But we have not seen the emergence of stronger health systems to a comparable degree. And actually, the Ebola epidemic attests to this because it exposed health systems in many, many countries. So, Madam Chair, the idea of the roadmap Healthy System, Healthy Lives is simple, but at the same time quite ambitious. We want to make sure that every dollar spent as development assistance for health is also a dollar which contributes to the emerging of a strong and healthy health system. So how do we want to approach this roadmap? It's twofold. Firstly, we need to revisit our health system strengthening means in the context of the 2030 Agenda for Sustainable Development. as we embark on a journey towards achieving universal health coverage. So this endeavor is very much aligned actually with the initiative presented today by Prime Minister Abe. But we want to have a fresh look. We not simply want to scale up what we have done in the past to strengthen the health system, but we want to bring in new ideas, new technologies, new partnerships that have been emerging over the last couple of years and make them more visible and at the forefront in order to achieve goal number 3. And secondly, of course, we also want to take into account and build on the past and ongoing processes and initiatives towards strengthening the health system and elements thereof. But we should also have a fresh look in assessing successes and failures. And we want to identify a set of concrete steps that need to be undertaken as a matter of priority in the future. And most importantly, we would like to generate a commitment to actually implement these steps in practice, adapting a new way how we collaborate as international actors in this arena. And we would like to support countries, our partner countries, in building up health systems on the ground in a more holistic manner. We hope that you're going to join this endeavor. We are going to share a note. We are going to analyze existing health system. The WHO has been very instrumental in shaping this initiative. We will read out with you. We are going to use forthcoming conferences like the one in Japan in December to discuss with you about our analysis. And hopefully by the middle of next year, we have a concrete implementation plan in our hand that would actually focus our endeavor on the ground to make health system work better for the achievement on the Agenda 2030. Thank you.
I'm afraid you could have in interest of time.
Let me turn next to the end of the table. Fatoumata Ndiaye, if I can turn to you. How is universal health coverage important to achieving SDG health targets for children?
I will just take that question from the perspective of the child. And the right to health is enshrined in the Convention on the Rights of the Child. And that convention says very clearly that children and their families should obtain health services, all the health services they need, meaning in quantity, in quality, and those health services should be affordable to them. The global goal for health continues to focus on strengthening health systems and strengthening social safety nets. So because of that, there is absolutely no dichotomy between the SDGs and universal health coverage. Experience has also shown in the past that when we strengthen the coverage of health services, we have reduced 50% of child deaths. So it is very important that we continue to focus on this. With all that we do at UNICEF, we focus on equity because it's the right thing to do. When we access the most disadvantaged children and their family, we are making the biggest improvement in health. So equity in that sense, when we talk about universal health coverage and we speak about equity, this is really synonymous of the human dignity. It is where we should go. We should make sure that when we improve universal health coverage, we are looking at equity in access, equity in services, in their quality, and also in their quantity. So in that sense, the SDG and the universal health coverage are really working together for child health. Thank you.
I can turn next to you. What within the global health architecture do you think we most need to strengthen in order to reach universal health coverage?
Thank you very much, and thank you to the organizers. you know, with the SDGs now, for the first time, we have a grand goal and specific targets to help us achieve universal health coverage. And this is a tremendous organizing principle because, as Professor Babatunde said, the goals are actually mutually reinforcing. So not only is this going to help promote health, as you just remarked, but it's also going to help promote several of the other goals, notably poverty and inclusive growth. So it's essential that we're able to deliver on this. Japan, our co-host and organizer of this, has achieved this in 1961, long before the global community rallied behind the idea of universal health, and this really helped to propel Japan's spectacular growth and shared prosperity over the last 7 decades. But globally, the equity gap is simply growing in global health, as we know. A yardstick that the World Bank Group has just developed with WHO demonstrates that 400 million people still lack access to basic health services, and at least 72 million are forced into poverty or deeper into poverty every year purely by health expenses. So health is a primary driver of poverty or a deepener of poverty. Now, the good news is there is a grand global movement toward universalism already. The bank issued a study, a book, just on Friday called Going Universal that looks at 24 countries, developing countries of all income levels across 5 continents, and demonstrates that they are moving toward universal systems. And these programs vary very much in their details and organization, but they share 3 primary characteristics. First, they are new. Almost all of these have begun in this century, so just in 15 years we made tremendous progress in this direction. Secondly, they are transformational. Not only are they improving access, but they are improving equity and the efficiency of health delivery because, of course, they're taking advantage of scale economies and the greater power of operating at scale. And third, they are massive. Together, they cover 2.4 billion people, nearly a third of the world's population. So they really portend tremendous promise for what we can do with this. However, if we're going to achieve that potential, we really have to come together in new ways, which I think speaks to your question. Whether it's for preventing maternal and child death, whether it's for ending AIDS, whether it's for achieving sexual and reproductive health, UHC has to be the platform because it's so clear now how interconnected all of these things are and the importance of acting in a coordinated way. Secondly, and closely related, we have to be aligned behind national strategies, country-owned and operated strategies that set out an articulate and integrated vision of how each country is going to pursue its universal coverage. And in Addis Ababa, we were pleased, along with many partners at this table and in this room, to launch the Global Financing Facility for Every Woman, Every Child, which is meant to achieve smart, scaled, and sustainable financing solutions built on country platforms. And third, as President Johnson Sirleaf and others have soberingly reminded us, the Ebola crisis revealed that we must prioritize public health investments as an essential complement to everything else we're doing and as an integral part of universal health coverage. And here, the global coordination and finance mechanisms are inadequate to purpose at this stage, which is why the World Bank Group is working very hard with many partners to explore a pandemic emergency financing facility to finance those crucial early weeks of response. Finally, it bears noting that the solutions to this and the delivery of UHC will depend on sectors well beyond health. We cannot deliver our goals in health without also working in education, in social protection, transport, energy, public finance, ICT, and other areas. So again, the interconnectedness of the global goals is essential. The other major factor we have, and I want to acknowledge this in closing, is the tremendous political leadership that we see now across the board in the G7, the G20, and I want to congratulate in particular the outgoing G7 President Germany for its use of the chair and leadership in this, and the very high hopes that we have from the leadership we're already seeing from the incoming G7 presidency of Japan and the major steps it's taking to keep this high on the agenda. So with this kind of momentum and integration, we have very high hopes.
Turn next to Magdi Martinez-Suleiman. Magdi, UNDP has played a leading role in focusing on particularly vulnerable populations and their rights, and you're an implementer of Global Fund programs in many countries. What do you think we need to do as a global community to ensure that the most vulnerable populations are included in the goal of universal access to health care?
Thank you, Elizabeth. And that is exactly the division of labour within UNAIDS, but also the role, the distinct role that UNDP has within the community. We believe that to deliver on the vision of the SDGs, this principle of leaving no one behind requires an explicit focus on the needs of the vulnerable, of reaching the hardest to reach, the last mile policies, as has been said. So universal health coverage, one of the targets under SDG 3, is an important means for achieving better health outcomes. At the same time, we're very convinced that there are significant non-financial barriers to accessing care, even when available and free, and that universal health care does not imply uniform delivery and access. Good health, we all know that, is ultimately the foundation of any serious development journey. That's true both for nations, for communities, for households, and for individuals. But when we look at the different shades of grey, stigma, discrimination and punitive laws, for example, continue to prevent certain groups, like people living with HIV, or men who have sex with men, sex workers, transgender people, drug users, from accessing HIV services, despite remarkable progress in scaling up efforts. So my first point is action outside the health sector can ultimately improve health outcomes, something that Keith just said himself. Again, the SDGs are a mesh. Compared to the MDGs, which were more vertical and less interrelated, the SDGs are more of a system. And when you press on one corner of the system, you should be obtaining multiple wins in the rest of the system. So there's a strong reciprocal relationship between health outcomes and other measures of social and economic progress. I won't delve on that, but it's obvious that gender equality, nutrition, or governance have a strong bearing on how health systems behave and how successful we are in progressing on health outcomes. The new development agenda is about accelerating progress, and I think we have to look not only at the most vulnerable populations, but also at the most difficult countries in which we work. We are a committed partner of the Global Fund. We play a role in supporting countries facing very challenging circumstances to deliver life-saving health services and build resilient systems for health. SDGs will be more difficult to implement in very vulnerable nations, in fragile states, in post-crisis settings. And more effective action can be implemented by those of us, we believe, who are on the ground in Syria and Yemen, in DRC, in the Ukraine, in Nepal, in Central African Republic, in Colombia, or in the Ebola-affected countries, in each of them for very different reasons, but again for the same reason, because it is tougher to work there and because there is less capacity. We think that beyond the global goal, and in many ways, the Global Fund, and in many ways with the Global Fund, our experience in supporting the Ebola-affected countries has shown that building health and community systems which are critical for sustainable development need a focus on vulnerable populations. And lastly, to translate the SDGs, including the target on universal health coverage, we need effective investments, policies and programs. Without political will and or without money, achieving goals is very difficult. But it's also true that it becomes possible when leadership and resources become available. Thank you.
Be able, with the incredible economy that the comments have been so far, to be finished by around 10 after 12. So I just ask your indulgence. We have two more panelists, and then we will go to Mark Dybel for closing remarks. So if I can turn next to Maureen Marenga. Maureen, you are a leading advocate in a global civil society network focused on ensuring that the global health community meets its commitments, especially to the populations that their SDGs and related goals are ultimately for. When you think about global health and the crucial need for access to vital health services all around the world, what is your vision of what we can achieve in 15 years?
Looking back, we have seen what we have achieved with the Global Fund, with the Millennium Development Goals in response to HIV, TB, and malaria. We have seen Global Fund not only saving lives in our communities, but also building resilient health systems and enhancing shared responsibility through encouraging sustained domestic investment in health. Looking back in 2002, I was in a situation. I was diagnosed with HIV and I was pregnant. I was unable to access treatment and I had high viral load, and the result was that I infected my child with HIV. He's now an adolescent living with HIV. Fast forward 2013, I was expectant again. This time I was able to access ARV treatment. I was able to access viral load monitoring, and I had a child who is HIV negative. So I'm a living evidence that Global Fund saves lives and that ending epidemics is a reality. Looking at 2030, I believe we can achieve a fully funded Global Fund and other efforts to respond to AIDS, TB, and malaria, and meet targets to end the three as public health threats. If partners give generously to the Global Fund today, in 2030 we will be celebrating the results of our actions. We will be celebrating governments that prioritize health of their citizens. We will be celebrating a sharp reduction of maternal and child mortality. We will be celebrating a HIV-free generation of children born to women and girls living with HIV. We will be celebrating a society that is able to access right-based services through strengthened health systems. We will be celebrating a world free of stigma and other gender inequalities, including gender-based violence. We will be celebrating life. Thank you.
Our last panelist, Deb Dugan. Deb, you have led a remarkable and innovative organization that raises funds from the private sector, and you and your partners have been tremendously successful, raising $300 million for HIV in Africa alone. What is your vision for the role of the private sector in moving us from the tremendous and impressive impact in specific diseases to impressive impact more broadly?
Well, thank you for recognizing the work of RED, but quite frankly, we couldn't do what we do without being in concert with countries and NGOs and many of you in the room. So I feel very honored to be part of this panel and in this venue. We all know that impact happens in small steps and in big swings. The Global Fund started as a public and private charter organization, but the big swings came from the countries in the beginning. There was $5 billion from countries, but only $5 million from the private sector. So it's about time that that swing starts, the pendulum starts to go the other way in a big way. So we know that doing good is good business. This generation, though, will totally demand it. 90% of millennials will switch brands to one that has a social good mission. 85% trust that company more, and 66% recommend that company to their friends. So there's been amazing work in money for the Global Fund and awareness that comes from the private sector, and stories like yours, Maureen, that we try to get top of mind for people around the world. Companies like Apple has given over $100 million to the fight against AIDS to the Global Fund, Bank of America. And then other companies have stepped up and used their skill set in a way to make a huge difference. So Coca-Cola, in talking about the last mile, they have used their distribution systems to help the Global Fund distribute ARVs in a more economical way, and that is rolling out to many more countries. SAP, whose motto is to make the world run better, is helping the Global Fund analyze their data better. So the shift has come from innovation in companies, not on their own products, but innovation in social good and certainly in the health realm more and more. So let's look to the tech and data revolution for the next big swings, whether it be a startup like Kenza that's doing a better thermometer that plugs into your smartphone for early detection of infectious disease, To all these companies that speak of a shared economy, let's force them to do shared responsibility. And companies like Airbnb can open their homes to voluntary health care workers. And then there's Mest Innovation Lab in Ghana that's coming up with great apps for health care workers. There's the Right to Care Clinic outside of Johannesburg that is using banking-like ATM machines to distribute life-saving medication. So we don't know exactly where the innovation will come, but I do think it will be the next big swing, and hopefully these tools can propel the work of the Global Fund and each of you in this room.
More warm thanks to our panel. Your remarks have been substantive, thoughtful, and you've been impressively economical, all of you, and thank you very much for such a rich discussion. So warm round of applause for everybody. And it's now my pleasure to give the floor to Mark Dybul, Executive Director of the Global Fund, for closing remarks.
Thank you, Elizabeth, and thanks to all of you for being here. We want to begin by thanking His Excellency the Prime Minister of Japan, Prime Minister Abe, for his personal leadership as demonstrated here today by organizing this event with the Global Fund, but also in the comments he made and by his physical presence. And having been in Okinawa, actually working for Prime Minister Mori at the time, we know how truly committed he is. We also thank Japan for, as the Prime Minister noted, hosting the Global Fund preparatory meeting in Tokyo, which has also been mentioned by Ingrid and others. We're very much looking forward to that. We also thank the co-hosts, France, and we want to thank President Hollande for, again, yesterday, restating his firm commitment to his pledge to the Global Fund and to the strong support he personally has for the fund. To Her Excellency, the President of Liberia, our dear friend, the Minister of Senegal, Prime Minister of Thailand, the World Health Organization, and World Bank. And in fact, all of you. You actually are the Global Fund. These panels are the Global Fund, not a secretariat. And I think this is a great demonstration of the partnership that comes together to achieve tremendous things, including universal health coverage. As most of the speakers have noted, universal health coverage actually underpins all of the SDGs. We cannot actually achieve any of the SDGs without a healthy population. Health and education form the basis of development, and that's what sustainable development goals are about. If you don't have healthy and educated people, you will not have poverty reduction. You cannot have economic growth. You cannot have equal opportunity. Without healthy, educated people, we cannot protect our environment. We cannot actually achieve any goals without healthy, educated people. And importantly, unless we reach the most vulnerable and marginalized who have been discussed, adolescent girls and young women, key affected populations, unless we go that last mile, we can't achieve the elimination of HIV, tuberculosis, and malaria as epidemics, but we also can't achieve any of the development goals that are put forward to us because we will not have equal opportunity, we will not have equal access, we will not have universal health coverage. And of course, all of that forms the basis of human security, which Japan, as noted, has been a leader in promoting. Our board, and we're privileged to have our chair and vice chair here, and many of our board members, in fact, everyone who's been on a panel is our boss, is our board in the Secretariat, our board members, have really emphasized the need to focus on resilient and sustainable health systems for health that get to that last mile, that reach the most vulnerable and marginalized, so that we can achieve a healthy, educated world for development. And so we're looking forward to our strategy development, which is aligned to our replenishment cycle, which is an excellent opportunity to promote these ideas that have been put forward here today. Wrapping up, we want to really thank the leadership, as has been noted, of Chancellor Merkel in Germany and their G7 and having health so prominent on the agenda of the G7 for this past year. And now Japan taking over the leadership for the Ise-Shima Summit will be an excellent, as we heard today, building off of that and promoting the Sustainable Development Goals and promoting universal health coverage. And that will follow TCAD, which will be a very important meeting because our Africa constituency has been absolutely adamant that resilient and sustainable systems for health has to be at the heart of what we do going forward. And so our family, our Global Fund family, is firmly committed to support everything that's been said today and to support Japan's G7, building on Okinawa, which is how we were born in the first place. So thank you very much for all coming today, and we are very excited about the future and working with all of you in a deep partnership to achieve health and development for all. Thank you.
You're adjourned. Thank you.